Chapter 16, Life Cycle Nutrition, Infancy, Childhood, and Adolescence. This is your learning objectives listed. Nutrition during infancy. During the first year, the fastest rate of growth and development occurs. By 4 to 5 months, birth weight doubles. By 1 year, birth weight triples. Length increases approximately 10 inches in the first year. Infancy is a period of rapid growth and development, and they need adequate nutrition to support that. Recommended intakes for infant and an adult compared on the basis of body weight. Energy requirements for infants are about twice as much an adult based on body's weight. A newborn might require about 100 calories per kilogram, whereas an adult would need less than 40 calories per kilogram. A newborn requires about 450 calories per day, and an adult needs about 2,000 calories per day. Infants require more calories and nutrients per kilogram of body weight than adults to keep up with metabolic processes, growth, and development. Relative to body weight, an infant's need for most nutrients are more than blank those of adults. Energy nutrients. Carbohydrates provide energy for all cells, but glucose is especially important for brain development. Fat provides most of the energy in breast milk and formula. Unlike adults, where carbohydrates provide most of the energy provided at about 45 to 65%, fat is the largest contributor for kids. Its high energy density at about 9 calories per kilogram supports rapid growth during infancy and also provides the essential fatty acids for brain development. Protein provides building material of body tissues, and protein is essential for growth and development. Energy and nutrient needs for infants. Energy intake. High basal metabolic rate to support rapid growth. About 100 to 115 calories per kilogram of body weight. Adults need about 30 to 40 calories per kilogram of body weight. A 15-pound infant, which weighs about 6.8 kilograms, would need 750 to 782 calories. Protein needs are listed below. Fluid recommendations. Water requirements for infants. Infants have a higher percentage of water compared to adults. The younger the infant, the greater percentage of water. Fluid is found outside of cells and is easily lost. Infants are at an increased risk of dehydration with episodes of diarrhea and vomiting. Breast milk should provide enough fluid. Unless it's an extremely hot climate, water can make a baby feel full without any calories or nutrients. Breast milk. Breast milk provides a unique nutrient composition, and protective factors promote optimal infant health and development throughout the first year of life, specifically suited to meet infant needs. The image is small, but it's in your text, and it shows the different nutrient composition of breast milk versus adult diets. You can find this on page 497. Iron fortified formula, which imitates the nutrient composition of breast milk, is an acceptable alternative. Breast milk. Amounts and forms of carbohydrate, protein, and fat are easy to digest and absorb. Higher lactose content enhances calcium absorption. The main carbohydrate in breast milk is lactose, which is easily digested for the baby, and it enhances calcium absorption. It is less protein than cow's milk, which puts less stress on the kidneys. Kidneys have to excrete less urea, which is the end result of protein metabolism. Contains DHA, which is critical for brain development, and it's low in sodium content. I ask that you pause this presentation momentarily to try to answer the questions. Benefits of breast milk. Immunological protection. Breast milk provides antibodies to help the baby fight infection. It's most valuable during the first year. Colostrum is produced in the first 2 to 3 days after delivery. It's a serum-like pre-milk substance containing antibodies and white blood cells. It also contains bifidus factors, which are present in breast milk and favor the growth of good bacteria in infant GI tract. Other protective factors include preventing the development of allergies and decreasing the risk of SIDS, as well as possibly preventing obesity and cardiovascular disease later in life into adulthood. You may pause the presentation to try to answer the questions before I reveal the answers. Advantages for mothers. The uterus returns to normal size quicker. Hormones released during breastfeeding help mothers heal quicker and can reduce postpartum bleeding. No cost. Baby formula can be very expensive, especially if you have a child with a food allergy. Sterile, proper temperatures, so there's no need to wash or warm up bottles, and it may help with weight loss as breastfeeding burns a lot of additional calories. Introducing cow's milk. It is not advised before age 1. Cow's milk can cause intestinal bleeding in infants younger than 6 months. Compared to breast milk, it's lower in vitamin C and iron, and it's higher in calcium, protein, sodium, and potassium. Milk can cause iron loss through intestinal bleeding and also fails to replace iron due to its low iron content. Children 1 year of age. At least 2/3 of energy is coming from food. You want to include a balanced mixture of fruits and vegetables, protein foods, cereal, etc. Reduced or low-fat cow's milk. Cow's milk can be introduced, but avoid fat-free or skim milk. Don't excessively restrict fat. At least 30% of total calories should be coming from fat sources. 2 years old. You can transition to fat-free cow's milk, and you still want to continue to avoid excessive restriction of fat. Introducing first foods. In addition to breast milk or formula, an infant can begin eating foods between 4 to 6 months. Usually, infants are developmentally ready for solids at this time. Purpose. Complementary foods provide needed nutrients that are not adequately supplied by breast milk or formula alone. Problems with early introduction. Inadequate starch digestion due to inadequate pancreatic amylase causes GI distress. And if given too soon, allergic reactions triggered by immune GI tract trying to digest or absorb intact protein. First foods are listed, and I'll allow you to read those yourself. Food allergies. Introduce single ingredient foods one at a time. You want to allow a period of 3 to 5 days between new foods, and this allows time to determine if there is a reaction, skin rash, diarrhea, etc. You want to introduce rice cereal first, then oat and barley, and lastly wheat. Rice cereal first because it's the least likely to have a reaction. Lastly, wheat because it's the most likely to cause a reaction. Allergic reactions can include skin rash, digestive upset, or respiratory issues. Peanuts. You want to introduce them early, between 4 to 11 months. New guidelines recommend introduction early rather than later to prevent a peanut allergy, unless it's a high-risk child with severe skin rash or egg allergy. Common allergens include egg whites, milk, soy, wheat, peanuts, tree nuts, seafood, citrus fruits, strawberries, and chocolate. Foods to omit. You want to avoid the following foods. Concentrated sweets or desserts. They provide excess calories and no nutrients. Products containing sugar alcohols, as they can cause GI distress like vomiting or diarrhea. Canned vegetables, as they are high in sodium. And definitely want to avoid honey and corn syrup due to the risk of botulism. Botulism is an often fatal foodborne illness caused by a toxin. Please pause the presentation momentarily to try to answer the question for yourself. Moving on from infants to toddlers. Discourage unacceptable behavior such as standing at the table or throwing food. Teach them basic manners. Let toddlers explore and enjoy food, even if it means eating with fingers for a while. They are more likely to accept foods they are familiar with. Don't force food on children. Rejecting food is normal, just keep giving opportunities to try it. Provide nutritious foods and let children decide which ones and how much they eat. Limit sweets. They recommend you do not use sweets as a reward for eating. Don't turn the dining table into a battleground. Make meals enjoyable and pleasant. Don't fight, scold, or argue. Nutrition during childhood. From 1 year to adolescence, height increases approximately 2 to 3 inches per year. Weight increases approximately 5 to 6 pounds per year. Growth charts measure height and weight at intervals, compared to other children of the same age and gender. Growth charts can indicate tendency towards obesity if weight gain is out of proportion with height gain. If significantly less than standard, it could suggest inadequate nutrition. The image is a 1-year-old versus a 2-year-old. As you can see with the 2-year-old, the child is much taller and there's less baby fat. Appetite and energy intake. Appetites diminish around 1 year of age. Food intakes coincide with growth patterns. The decrease in appetite is consistent with the slower growth rate. Energy intake can vary from meal to meal. One meal might be more or less than another. Total daily intake should remain fairly consistent. Children's needs vary greatly. You have periods of rapid versus slowed growth, as well as physical activity levels. You will need more energy or calories during rapid growth and with physical activity. Nutrition during childhood. Energy requirements are as listed. Inactivity can lead to obesity, and these are estimates to meet the needs of most kids. Other factors like height to weight ratio, activity, and catabolic illness can increase or decrease needs. Protein requirements are as follows as well. Remember, the RDA reflects the average daily amount needed to meet the needs of most healthy people. Nutrition during childhood. Fat and fatty acids. Fatty acids are critical for brain development. Children 1 to 3 years should have 30 to 40% of energy from fat. Children from ages 4 through 18 should have about 25 to 35% of energy from fat. Low-fat diets may also have low vitamin and mineral content. Planning children's meals. Include variety from food groups. Avoid excess sweets. Offer healthy snacks. Include iron-containing foods. Children are prone to what are called food jags, and that's the consumption or acceptance of one food or a limited number of foods for a period of time. Iron deficiency. Effects of iron deficiency or anemia during childhood. You may see learning difficulties or difficulty paying attention. Iron deficiency also lowers motivation to persist through challenging intellectual tasks, poor physical stamina, and disruptive behaviors in classrooms. Food sources of iron include iron-fortified cereals and breads, meats, poultry and fish, shellfish, and eggs. The number of overweight and obese children in the U.S. has increased dramatically over the last 4 decades. It's estimated that 32% of U.S. children and adolescents between 2 to 19 years are overweight or obese. This is influenced by both genetic and environmental factors, including parent obesity status. So, parent obesity increases the likelihood that a child will become obese. Diet and physical inactivity. The American diet has changed and our activity level has declined. We have more access to TVs, cell phones, video games, etc. Eating outside of the home, fast food chains, restaurants, places like Wawa, where you can just stop and grab food at any time. They provide large portions and high fat and salt content. Parents as role models, kids usually do what parents do, so try to set a good example. Eat plenty of fruits, vegetables, whole grains, etc., and exercise. Added sugars and empty calories. Empty calories provide about 1/3 of the total energy intake for ages 2 through 18, and they provide no nutrient value, things like vitamins, minerals, and protein. Determine weight status for children and adolescents. For children and adolescents, you would use growth charts, not the BMI scale. 85th percentile and above is considered overweight. The 95th percentile and above is considered obese. Recommended behavior to prevent obesity. Healthy habits recommended for children 2 through 18 years of age to help prevent childhood obesity. Limit or avoid consumption of sugar-sweetened beverages like soft drinks and fruit-flavored punches. Eat the recommended amount of fruits and vegetables every day. Learn to eat age-appropriate portions of foods. Eat foods low in energy density, such as those high in fiber and/or water and modest in fat. Eat a nutritious breakfast every day. Recommended behaviors to prevent obesity continued. Eat foods rich in calcium every day. Choose a dietary pattern balanced in recommended proportions of carbohydrate, fat, and protein. Eat foods high in fiber every day. Eat together as a family as often as possible. Limit the frequency of restaurant meals. Limit television watching or other screen time to no more than 2 hours per day, and do not have television or computers in bedrooms. Engage in at least 60 minutes of moderate to vigorous physical activity every day. Energy and nutrient needs during adolescence. Growth and development. With the exception of pregnancy and lactation, energy and nutrient needs are higher during adolescence than at any other time of life. That's as in total calories needed, not in calories per kilogram. Growth spurt. So growth speeds up and continues for roughly 2.5 years. Growth spurts for females usually starts at around 10 or 11 years and peaks at 12 to 13 years of age. For males, starts at about 12 or 13 years and peaks at 14 to 16 years. It lasts about 2.5 years. Females grow about 6 inches taller, add a higher percentage of fat, and gain about 35 pounds. There's an increase in estrogen. Males grow about 8 inches taller, add higher percent of lean body mass, and gain about 45 pounds. There's an increase in testosterone. You can pause this presentation momentarily and try to complete the matching section. Energy and nutrient needs during adolescence. Energy intake. Needs vary depending on rate of growth, gender, body composition, and physical activity. Energy needs can range from 1,800 calories per day for an inactive female to 3,500 calories per day for a highly active male. Keep in mind, boys tend to grow faster and are developing more lean muscle mass, so they'll likely need more energy. Protein. For males and females between 9 and 13, they'll need about 0.95 grams per kilogram, and for males and females between the ages of 14 through 18, decreases slightly to 0.85 grams per kilogram. Calcium, vitamin D, and iron needs. Needs for most vitamins increase. Iron. Females' needs increase because of menstruation. Iron deficiency is most prevalent in adolescent girls. Males' needs increase because of developing lean body mass. Calcium. Developing bone mass. Adolescence is a critical time for bone development, and calcium requirements reach its peak during these years. Low calcium intakes and physical inactivity can lead to osteoporosis later in life. Remember, vitamin D enhances calcium absorption.